U.S. government agencies are committed at the highest working together to protect the health and well-being of both Americans and Kenyans. Our shared missions offer countless opportunities for confident that by joining forces we will continue to achieve great things. As we celebrate our 60th anniversary of the relationship between the United States government and the government of Kenya, we reflect on our joint achievements in health, from controlling infectious disease, improving maternal and child health, and preventing non-communicable diseases. Our cooperation has made significant strides. We also celebrate our successes with initiatives like the United States President's Emergency Plan for AIDS Relief, we lovingly call PEPFAR, the President's and our efforts to continue to advance health systems in Kenya. Today, we commit $31.1 million to the Kenyan health system with digital data through support for facility and community information systems. And if the minister has her way, she'll take all of our data scientists home with her to power million. Additionally, the U.S. government has provided professional development to hundreds of thousands of Kenyans. Moments ago, we launched a health-focused emergency management training program during our tour of the Emergency Operations Center that will build the capacity of public health across Kenya. Finally, we are pleased to announce a twinning relationship between the Kenyan National Public Health Institute and the UNC, our nation's public health institute. At HHS, we recognize the critical role of global health diplomacy in security, improving health outcomes, and advancing sustainable development goals. I'm excited about the possibilities that lie ahead, opportunities to deepen collaboration, leverage our respective strengths, and achieve even greater impact. During this visit, we look forward to a renewed partnership for Disease Control and Prevention and the Kenyan Medical Research Institute, or KEMRI, and to setting the framework for our future collaboration through PEPFAR that supports Kenya's vision for the health of its citizens. Thank you all for welcoming us here and for our distinguished guests joining us today.
Thank you, Your Excellency, the President of the Republic of Kenya, Dr. William Samoei Ruto, my friend, Deputy Secretary for Health, Director CDC Cohen, Prime Cabinet Secretary, senior government officials from both Kenya and the United States of America. Today is a profound day for us to be here, meeting here to discuss and celebrate our collaboration, especially the Ministry of Health with CDC and the United States of America. Your Excellency, we could not have come at a better time than now. As we sit here, the world is now converging to discuss national health regulations, to discuss the pandemic treaty. And all this is to build consensus for members around the globe to be able to prevent, to detect, and to respond to public health emergencies. We have here, Your Excellency, at the Emergency Operations Center. So, Your Excellency, as a country, we have taken the steps of the CDC, and we are now establishing our National Public Health Institute, and it's just to ensure that we are able then to be together with the world as they prevent, they detect and respond. Your Excellency, infectious diseases do not know geographical boundaries. It doesn't matter if you're in Kenya or you're in America. COVID taught us the lessons. So it is for us as Kenya, CDC, and the United States of America people to work together to ensure that in future, should we have future threats, then together we are able to surmount that. CDC, I want to say thank you on behalf of the Ministry of Health for the collaboration with Kenya Medical Research Institute that is represented here to Songok. You have worked very well with us to build our capacity through the FELTEP program. You have worked very well with us to build nation's capacity, and we are forever grateful. How do I see the next steps, Your Excellency? We now have a baby, the National Public Institute. Our success will be measured on how we collaborate and ensure the National Public Health Institute is able to respond to emergencies as they occur. Your Excellency, I have had the opportunity to say to the Deputy Secretary, she did visit our ministry together with Cohen, the Director of State, a long chat on our plan for universal health coverage. And we did agree that now we are going to plan and build into our priorities. I'm so happy that finally the programmatic areas that we've been having, the vertical responses on HIV, on malaria, reproductive and maternal health, today we are going to find a future where we work together to ensure that we protect our people. Thank you very much.
Thank you so much, Health Minister. So to set the stage for the next part of our discussion, we're going to be going from the large picture of the U.S. government investment, which is about $600 million a year investment, to what is needed for a sustainable Kenya-led health programming. We want to make sure that we're focused on transferring sustainable health programs to the government of Kenya for country-led implementation and ownership. And one country-led programming is creating opportunities for local manufacturing of health commodities. So now I want to welcome Dr. Atul Gawande, Administrator, who's going to discuss the topic of regional manufacturing.
Your Excellency, colleagues, two things that COVID taught us were about the importance for sustainability of regional manufacturing of medical capacity available at the ready when crisis hits, and the importance of strong primary healthcare systems that connect, that deliver on that capacity. Today we're reflecting on the success of our joint partnerships in both of those domains to try to the celebration of the remarkable leadership, President Ruto, you have made in both these domains. I've seen you speak from incredible knowledge about these areas. First of all, to comment a little bit about how you're leading the way on primary health care. You have set up 4 laws that have dramatically changed the landscape. First of all, by committing to more than 100,000 paid community health workers, an extraordinary standard. It's raised the bar for the entire continent. And you are not only making sure you are making sure that they are part of a digital health information system where the electronic records are in their hands. And then furthermore, that they are part of primary care networks that link them to every other health system. They become the outreach to the community and the eyes and ears of the entire system. And that is a process that we are all across the U.S. government of being part of. When I visited Kenya last November, out of 315 primary care networks that were established as a goal, there were 26 with support from USAID, CDC, and the Department of Defense. I'm proud to say that now 151 primary networks have been established, 2/3 of which are with the support of USAID, CDC, and the Department of Defense. Now our teams are working together to build that capacity. Can't do anything if they don't have supplies and goods that are needed. And you are also leading the future of what our partnership can be with countries across the world for building capacity. Revital Healthcare is a prime example of what that future looks like. It is a Kenyan company based just outside of Mombasa with a USAID grant of $2.2 million and another $2.2 million in matched funds from Revital itself. The company built the largest medical diagnostic manufacturing plant in Africa. Capable of producing 240 million test kits per year. Further, Revital has developed its diagnostic tests for HIV, malaria, hepatitis B, hepatitis C, dengue, syphilis, and pregnancy produced on-site in It's places like Revital that have given the U.S. PEPFAR program to set a goal to purchase a total of 15 million African-made tests in 2025 and an estimated cost of $20 million from African manufacturers. And so with that kind of commitment to significantly expand purchasing by these programs, USAID is working with the WHO, the US FDA, the Global Fund, African manufacturers, and regional accreditation and regulatory bodies that manufacturers like Revital can manufacture global quality approved tests for serving the needs of Kenya, Africa, and the U.S. President's malaria initiative is likewise actively investing to increase the number of malaria commodities like tests and treatments made on the continent. Africa is home to 94% of the world's malaria cases, but the majority of malaria are imported from elsewhere. And so in the last year, PMI, as the program is called, has doubled its purchasing of African supplies for anti-malarial drugs and treatments. For example, from the Kenyan manufacturer Universal Corporation Limited, and from also another Kenyan, Life Sciences. This also includes work with Revital as it goes through the process to achieve WHO pre-qualification for malaria rapid tests, which will enable them to be candidates for procurement by PMI in the future. These approaches, the commitment, all of the connections that have had to be made are nothing short of transformative. Not only are we building health systems to deliver quality service possible, but we're supporting industries that can equip those systems. Kenya's leadership setting pace. As Kenya's economy continues to grow, we're going to see mutually beneficial skills, technology transfers at the foundation of the relationship. And one company that I've mentioned already leading the way in these new future partnerships is Revital Healthcare. I'd like to turn it to Harsh Mehta from Revital. He's the Director of International Business Development and can talk a little bit about what Revital is doing.
Rapid of 20 million test kits per month. When we started in the year 2008, it was only 2 million medical devices per month. We're now manufacturing and exporting more than 200 medical devices per month. The positive impact is to ensure that our own country and our own continent receive